All right, welcome everyone, and thank you for joining us for today's webinar on a whole person approach to mental health. My name is Molly Buss, and I'm the Community Relations Manager at the Earl E. Bakken Center for Spirituality and Healing, and my role for this webinar is to moderate the chat. Please feel free, if you haven't already introduced yourself, to do so in the chat, perhaps sharing where you're joining us from or what you're excited to learn about today. I also want to give a quick introduction of the Bakken Center for those who may not be familiar with our work. It is our vision to advance the health and well-being of individuals, organizations, and communities through integrative health and healing. And during the COVID-19 pandemic, we have strived to provide free resources and webinars to help you navigate these challenging times. And we need your help to continue to do this work. So if you are able to, please consider making a donation of any amount, and more information about how to do that will be available in the post-webinar email. Just a few logistical items I want to review to help you navigate the webinar functions. You're welcome to share your thoughts and comments via the chat box. If you're comfortable and want to share your responses with all participants, please make sure to update the to field in the chat box to all panelists and attendees. And then just note that you do have the opportunity to minimize the chat box during the presentation, and we invite for you to do that during the components that aren't interactive to help you remain present. There's also a Q&A icon where you can submit your questions, and we will ask our presenter as many questions as we have time for at the end of this session. If you aren't able to find those icons, hover your mouse over the bottom of your screen and they should appear for you. We will be sending out an email with lots of resources, a recording of the webinar, a copy of the PowerPoints slides later this afternoon, so please look for that. And I am now delighted to introduce Dr. Mary Jo Kreitzer, founder and director of the Bakken Center for Spirituality and Healing. Mary Jo will be facilitating the Q&A segment, and we'll also share some more information now about our presenter.
Well, thank you very much, Molly, for that introduction and that welcome. And I'm so pleased that all of you could join us today for this webinar, A Whole Person Approach to Mental Health. Mental health is not something that only happens above the neck. Mental health challenges like anxiety, depression, or ADHD affect the whole person's health, their lifestyle, and general well-being. The University of Minnesota Integrative Psychiatry and Wellness team strives to offer integrative or holistic approaches along with conventional psychiatric treatments. The goal is to treat mental health symptoms and simultaneously cultivate physical and emotional well-being. We are joined today by Dr. Lydia Zylowska, who's an associate professor in the University of Minnesota Department of Psychiatry and Behavioral Services and a faculty member at the Bakken Center for Spirituality and Healing. Dr. Zylowska completed a fellowship at UCLA Center for East-West Medicine and is a diplomate of the American Board of Integrative Holistic Medicine. Within psychiatry, she leads the Integrative Psychiatry and Wellness program, where she teaches trainees about integrative psychiatry. She's also an internationally recognized expert in adult ADHD and mindfulness-based therapies, and she's a co-founding member of the UCLA Mindful Awareness Research Center. Her research has been published in peer-reviewed journals, and she is the author of an award-winning book, The Mindful Prescription for Adult ADHD. Her most recent book is titled Mindfulness for Adult ADHD, A Clinician's Guide. Dr. Zylowska will describe today the Integrative Psychiatry and Wellness team's approach. She'll talk about integrative treatments, including supplements, making modifications in diet, functional medicine, and acupuncture for mental health. And she'll also discuss how mindfulness, self-compassion, and positive psychology can decrease the impact of stigma, often found in mental illness, foster acceptance, and build resilience. After Dr. Zylowska speaks, we'll host a Q&A, so please, during her presentation, be adding your questions under the Q&A icon. And during the Q&A session, she'll be joined by members of her team. Welcome, Dr. Zylowska.
just taking a moment to turn on the camera. Go. I'm having some difficulty turning on the camera. Molly, are you able to do that for me?
Just one moment, Lydia. I think I can ask you to start your video. You might get a notification now.
Great. Thank you, Molly. And thank you everyone for being here. Thank you, Mary Jo, for your introduction. I'm really excited to be able to speak with you today. And I'm really glad that so many of you took the time to join us today. I will be speaking about the whole person approach to mental health. And in my presentation, let me just move the slides. I'm sorry, having a little bit of a technical issue here. Okay. Okay, now it's working. Sorry about that. So we'll talk about what is whole person approach, how that connects to integrative medicine and psychiatry, and go over some foundational practices that can support mental health and resilience, talk about different tools from integrative health field. And then I'll tell you a little bit more about our team at the University of Minnesota Psychiatry department, and then we'll have some time for questions. So as Mary Jo mentioned, there's some assumptions about mental health that even though we do know that, the mind, the brain, and the body are very interconnected, still, when you think about it, how our treatments are done, typically we think of mental health and mental health treatment as something that we address, above the neck. So we think about working with the mind or using, through psychotherapy or using medications that work on the brain level, on the neurotransmitter level. So the whole person perspective is really to recognize that tendency that we have of really thinking of mental health in this limited way, and think of the whole person, and very much bring in the body into thinking about mental health. At one point, there was a slogan that NIH had for the Mental Health Awareness Day that said, "No health without mental health." And I would like to also flip it to say, "No mental health without health." So it's really very much interconnected. And if you look at, the totality of the person, we have to think about this bidirectional and sort of very dynamic balance between the mind, brain, and the body, and also bring in the spiritual and the social dimension, both when we think about mental health and when we think about the causes or the treatments for mental illness. And here you can even see that, when you are, for example, depressed, your whole body is depressed, or your posture changes, and also, as we are learning now through our research, is that so many physiological processes are also affected. So when you start thinking about this whole person perspective, it really brings new ways of treating the mental health symptoms. There are ways to think about how to support somebody through some fundamental practices that engage physical wellness. And it also, it's very much aligned with holistic or integrative medicine perspectives and tools. So you can bring in tools from complementary alternative medicine and combine them with conventional approaches. And I just want to quickly outline some of the assumptions of integrative health that apply to mental health as well, is that we don't just look at absence of symptoms or absence of disease, but looking at optimal wellness and well-being. And I'll talk about the spectrum of health, or particularly mental health, that in this approach, you want to support self-healing power of this mind-body interaction, looking at prevention and teaching self-care skills, and getting to the root cause that may be underlying the expression of mental health symptoms. Also, we want to emphasize natural and safest long-term treatments. So there may be kind of a phases of treatment when there's more acute or more sort of invasive treatment, and then trying to think of how do we then get the person to rely more on these more natural, safer, and maybe self-healing methods in the long run. This really expands this perspective, and bringing holistic medicine expands our toolbox. And in this approach, there's a big emphasis on being collaborative, thinking about what's the best for the patient, what are their preferences when it comes to also treating their mental health. So here's a mental health continuum. Sometimes, or oftentimes I should say, we think of mental health when there's a problem, when there's already a mental health disorder or significant symptoms. But it's very helpful to expand that view and think about this mental health continuum from the green zone of coping well or even thriving to moving into the yellow, orange zone of having stress and having impacted by it, and then with different degree of success responding to it, and then how at times when the stress or whatever is going on in a person's life, that could be psychological stress, it could be physiological stress, that, or even stress coming from the environment, that the ability to respond and cope and be resilient is overwhelmed. And then you can move into the red zone. And you could say that, you could be the most resilient person. And there are maybe circumstances when you do shift into the red zone. And that can really, I think, help think of stigma. Sometimes when you approach mental health only as something, only the people that are not coping well, or only the people that are somehow vulnerable, or that, mental health is this thing that you're broken. And then there brings some feelings of shame or, wanting to not share it. That once you start thinking about this continuum, we realize that we can move along this continuum. Our loved ones, our friends, neighbors can move along this continuum. It becomes a little bit, I think, easier to think as this is something that is part of health. This is something that we need to really attend to, whether we are in the red zone or not. And, depending where you are on this continuum, there's different tools can be helpful. Here's a very long list of different tools, both in terms of kind of the supportive fundamental practices that you could apply when you're in the green zone, and then tools as you're moving along that spectrum, let's say to the orange and red zone, there are already symptoms, there's some difficulties that you can start working with either a clinician or start using things such as supplements or herbs to help you, cope more effectively. When things are really difficult, the conventional therapy approaches such as psychotherapy, medications, treatments like TMS or ECT or hospitalization can be necessary. But really looking at all these tools and deciding together with the patient, what makes sense here for you right now. And I'll talk more about these tools as we go along, the different wellness fundamentals and integrative strategies. So the proactive approach to mental health is something that we all need, thinking about how can I cultivate it, even when I'm not necessarily right now experiencing a mental health disorder. And year 2020 tested all of us. I mean, this is a time when we all experience tremendous stress, and I here have layers of things that I think came our way in 2020, and many of them still continue. The pandemic, social distancing, having to have new routines, adjustments to that, for many financial stressors, for many of us worrying about being sick, getting sick, or even dealing with a loss and grief on a kind of our society level, there's been a lot of turmoil. There was George Floyd's killing. Then we had very contentious elections. And, for many of those who are caregivers, there's been added responsibilities or at home schooling and this juggling that can make someone feel very, stressed and overwhelmed. So just want to acknowledge how much all of us have been through and continue to deal with, and how important it is in that context to support mental health. So here are some fundamentals, and these are very much aligned with the Center for Spirituality and Healing's model of how to support well-being. So well-being and kind of mental health wellness going hand in hand, looking at things like lifestyle, diet, hydration. I mean, for many people, especially now sitting in front of screens and computers, I think might not be as natural to feel the sense of thirst or attend to hydration, not having enough movement, having sleep that is regular, and paying attention to the use of media and screen and exposure to digital screens, especially before bedtime, and having some sort of strategy about stress management, knowing what are my triggers for stress, and then what are my tools. And a couple of tools I will highlight is mindfulness and self-compassion. There's such key tools for mental health. Relationships, really reflecting on how do I relate to others, to what are my support systems, how do I relate to myself? And that's where self-compassion comes in. And also relationship with the spiritual side, thinking about that dimension, as that can be supportive to mental health as well. Looking at environment, connection to nature, issues of security. How am I secure in my life, financially or emotionally, in my relationships? And in addition to really working with these negative emotions that may come up at time of stress, cultivating positive emotions as a counterbalance. And I'll talk about the positive psychology approach to that. So this is the common slide that you may see about the stress response. Stress being, often the driver of mental health symptoms. And typically, when something seems to be threatening to us, and this might be something that's threatening to us, but maybe not to another person. But if there is some sort of threat, our minds, our bodies often go into this flight or fight or freeze response, with adrenaline and cortisol being released, with physiological adjustments in response to that, heart rate changing, breathing, changes of blood flow to your organ systems, digestion shutting down. And when the threat is removed, there is a system in the body, the parasympathetic nervous system, that then kind of quiets that response, allows the adrenaline and cortisol to return to normal, and the whole body to return to normal. Of course, when the threat or the sense of stress is ongoing, we don't fully recover, and this can be a setup for chronic stress and these chronic changes in our physiology. And how do we deal with this sense of threat or stress? Here's a quote from William James, a 19th century psychologist, that said that the greatest weapon against stress is our ability to choose our thought, or you could say our reaction, over another. And this is thinking about this sort of top-down approach to stress management. And with that in mind, mindfulness can be very helpful. And mindfulness, as many of you know, is an approach from meditation. But it's also something that can be practiced in daily life. It's a shift of attention, bringing attention to the present moment. And it's a shift in attitude that goes along with it, of bringing curiosity and openness to your experience. And the value here, especially when it comes to stress management, is that you can start checking in and connecting with yourself when you're stressed, and noticing, what is causing me to be stressed? How am I responding to that? And when there is a lot, of a response, especially if there's a lot of negative emotions, noticing, am I relating to myself in a judgmental way, or is it more of an accepting and compassionate way? And oftentimes just offering yourself, this is hard. I'm stressed. This is, I'm struggling. Just that offering of compassion, that acknowledgement offering of compassion can really make a difference. We do know that mindfulness very much engages different circuits in the brain that have to do with attention and emotional regulation. And that can also enable, certain, how we act, how we show up in our life. So it's very much connected to this idea of self-regulation, or you could say resilience skills when responding to stress. I want to focus a little bit more on the self-compassion piece. Oftentimes when under stress, when there's a lot going on, many of us do become, more harsh with ourselves, or maybe more judgmental. There may be a sense that I should be doing more, I'm or being even afraid of how you're reacting to stress. And so bringing self-compassion is a key. And there are different ways to practice that. There is a practice called loving kindness, or metta practice derived from Buddhism. There's also work by Dr. Kristen Neff that I want to highlight that has a certain steps of really bringing a sense of kindness to yourself during moments of suffering, acknowledging that you're not alone in suffering, and then offering yourself, whether through words or through gesture, some kindness. So I want to give you, there's a resource here if you wanted to explore this further. And this is, the practicing of self-compassion is very much in line with what positive psychology brings to the whole field of psychology and mental health, which is, let's shift the lens, or at least balance the lens from just looking at negative emotions to thinking of how to bring up positive emotions in one's life. Things like gratitude, really finding, connecting to things that bring us joy and meaning, savoring those experiences, finding things that really bring us to a sense of ease, activities that are kind of a good, a natural activities that make us feel alive, or finding flow in them, bringing authenticity to relationships, finding areas where you can have sense of mastery or accomplishment, and finding meaning. And this is something that we actively bring with our approach at U of M, and you'll get to meet a member of our team, Debbie Cohen, who very much talks about this approach in her teaching. So those, the mindfulness, the positive psychology pieces are very much this still top-down approach to stress regulation. If you start thinking about the body and bring that dimension, then you can start also working on the stress regulation from bottom up, through movement, through breath work, through practicing that on a regular basis. What you can see is that for example, practice of yoga, Tai Chi, or even, dancing, or there's type of meditations that really engage in the body, in active breathing, or, dancing and shaking meditation, that you can change your body state, and the mind state follows. And you often can have this more natural shift into positive mindset. The other bottom-up approach would be healthy diet. We do know that people with mental health difficulties tend to have diets that are more unhealthy. So, and you could argue, is it that when you are depressed or anxious, you tend to eat worse foods, or is it that because you're eating worse foods, that you're more likely to shift into anxiety and depression? And the research has looked at that, and actually it seems that the unhealthy diet precedes anxiety and depression symptoms for many, in many cases. So one thing that can be done to build your stress resilience is to look at your diet and think about stopping the bad foods, things like processed meats, refined grains, a lot of sweets and high fat foods, and try to think of kind of cleaning up the diet. And at the same time, bringing up the foods that we know support the brain functioning and support mood. A good example of that is a Mediterranean diet, and I'll talk more about it in a second, as well as supporting the healthy gut function. There's a lot more understanding about the brain-gut axis, how this constant communication between those networks, and having foods that are feeding healthy bacteria, prebiotic and probiotic foods can be helpful. There is more and more understanding that when you have healthy diet, when you remove the negative foods as well, that you can reduce mood states, you can reduce the stress response. Other physiological responses can follow in terms of lower inflammatory cytokines, better markers of oxidative stress. We can also see changes in the anxiety, depression. There's also pretty exciting work that's happening at kind of trying to understand the composition of the microbe or the bacteria in the gut and the brain structures, as well as responses to emotional stimuli. And so it really sort of breaks apart this idea that, who we are is because of our mind and the brain. It's also who we are, how we respond to stress is also how is our gut, how is our body doing, and all these other responses along the immune, inflammatory, endocrine systems. Here's a study that was really important in this field. They call it the SMILE study from Australia, that looked at changing the diet of a group of patients who had depression and seeing if those changes in the diet would have effect on the depressive symptoms. And they did indeed find the effect. This was kind of a modified Mediterranean diet that shows you sort of the recommended intakes of food. So emphasis on whole grain foods, vegetables, low-fat dairy, incorporating olive oil and nuts in your daily diet, and using lean protein with regular, at least 2 servings of fish during the week. And what was interesting in this diet, in the study, is that, some people have lost weight, some people didn't, but the improvements in mental health symptoms were related to the dietary change, not necessarily to the fact whether your weight changed, and really showed the connection between what we eat and what our emotions are. If these fundamental practices are not enough, oftentimes we need to turn to integrative strategies that are often done. The best way to do them will be with guidance of a clinician. When the brain-gut axis is affected in a way that you're starting to have GI symptoms, maybe having a sense that you're not digesting things as properly. If there's other difficulties, whether it's an autoimmune conditions or inflammatory conditions, really looking at optimizing that axis is important. And that can be done through either diet manipulation, for example, eliminating certain foods, adding supplements and herbs that either work on helping the gut function, or really also looking at how they may be affecting other processes in the body and affecting the brain. Manual physical therapies, and also looking at some whole systems of care, like functional medicine, traditional Chinese medicine, and Ayurveda, which can be very helpful in looking at sort of your constitution, or kind of individualizing these approaches, looking at deficiencies, looking at your physiological strengths or weaknesses, and trying to bring best treatments to harmonize or to rebalance the body. So here's a very busy slide, but I want to just highlight this emerging science of it within nutritional psychiatry, and also look at that neuroendocrine psychiatry that looks at the gut-brain axis, or sometimes referred to as the mind-brain-gut axis. That stress can have effect certainly on the brain and our responses to it, but it also feeds down into the responses on the gut level. And if it's excessive, it can lead to what we call dysbiosis, or the shift in our healthy bacteria to bacteria that are really not as helpful in creating healthy balance. And this happens to neuroendocrine, neuroimmune, autonomic systems. And in fact, the gut is often referred to now as this enteric nervous system, because we know there's such a rich network of neurotransmitters and receptors and connections to the central nervous system going on there. But this slide is not only highlighting that once stress is prolonged and you develop dysbiosis, you really have to address it, but that the stress can be coming also from things like having, let's say, infection, taking antibiotics for a prolonged period of time. The stress can be because of physical or surgical issues that affect the digestion or processing in the gut. And then you can have the sort of the spiral effect of nutritional deficiencies that then feed back to the brain. Here's a nice slide that I borrowed from one of members of our team, Dr. Crystal Montgomery, how she approaches working with repairing the gut-brain axis and supporting healing in those communications. So really looking at how your diet is and promoting foods that balance blood sugar, using low glycemic foods, supporting elimination, whether it's through hydration and movement, or herbs and supplements, using probiotics or prebiotics, we'll talk about in a moment, looking at inflammation markers. What's the burden of inflammation? Can we look at lowering that through either lifestyle or through the supplements? And looking at essential nutrients. We do know that for a lot of people, even if they eat healthy diet, they may still be deficient. This is part because this is something we know from agricultural sciences. The amount of trace minerals and sort of nutritional value has been declining in plants in the soil. So even when you think you're eating healthy, especially if you have a vulnerability and your gut, it might not be working properly, you may not be getting enough nutrients. So even with the lifestyle interventions, you may need extra help. So here is a little bit about prebiotic and probiotic foods that can support healthy bacteria in your gut. This is something that there's some art and science to it, and depending on what else is going on in your health, it's important to figure out, do I need to work with a clinician or not on this? In general, if you know that you're not digesting very well, there may be bloating, or your gut is just, you're having some discomfort, sometimes just proactively taking probiotics can be helpful at the lower doses, and seeing if that helps. If that doesn't help, perhaps you need another kind of probiotic or another dose, and again, either working with your clinician or seeking someone who can advise you on that will be helpful. The probiotics are generally safe, but if you have a compromised immune system, you have to be careful in how in using it. Probiotics can be delivered as foods, so fermented foods, sauerkraut, kimchi, foods like this, tempeh, Or you can use supplements, taking it in a pill format and making sure that the bacteria is live. Now let's talk about some common supplements. There's a variety of supplements that are being either recommended or tried for mental health. Here's some main categories of either vitamins and minerals. Some of the important ones here are supplements that support the folate metabolism, L-methylfolate, vitamin B vitamins, vitamin D and C, also looking at minerals such as zinc. There's a trend now to look at broad-based micronutrient formulas instead of just using one thing, trying to use a combination of things, because we do understand that multiple vitamins and minerals support each other in metabolic processes. And so also looking at your unique vulnerabilities, that's when some of the testing can be helpful. Am I particularly deficient, for example, in vitamin D? And in Minnesota, all of us are at risk for that. And we know that higher levels of vitamin are associated with more resilience to depression. Another common supplement is looking at fish oil or other sources of omega-3 fatty acids. That's been pretty well studied in a number of different mental health conditions, showing that supplementing with fish oil can be quite helpful, or increasing the intake of fish in your diet. Typically for depression, for example, we would recommend around 1 gram of fish oil, which is about 3 servings of salmon. That's not always practical or doable to do 3 servings of salmon in a week. So if you are having some tendency of vulnerability to depression, taking a supplement can be helpful. Other types of supplements include amino acids. I listed some of them. Common ones are the ones that are supportive of neurotransmitters that are used in anxiety and depression. Things like tryptophan, a precursor to serotonin, tyrosine or phenylalanine, precursors to dopamine. So depending on your condition or sort of your symptoms, is there a lot of anxiety or is there a lot of fatigue? Those supplements can be tailored. We have a pretty good also evidence for using SAMe as an alternative antidepressant. There is also good evidence for using melatonin as a non-addictive sleep aid. In addition to that, there's also herbs. And herbs are something that I wouldn't lump them in the same category with supplements, because herbs as plant derived, you have to be very careful about how they're processed, what is the source. And also with herbs, there may be interactions with medications that you have to consider. Here's some common ones that I've listed. I think a well-known one is St. John's wort that can be used for mild to moderate anxiety and depression. To be careful with interactions with other medications. So it's a good choice if you're not on a lot of other medications. And here are some examples that I like that are things that are problematic in conventional psychiatry. So we often struggle, how do we treat anxiety? How do we help with sleep without making someone too tired or sedated, without making them dependent on the medication? So it's nice to have this more expanded toolbox with options that can address anxiety, sleep, like valerian, and not be habit forming, or something that can help with anxiety, but not create sort of the sedation or the cognitive dulling, something like bacopa. Also, within the herbs category, we have a special kind of substances called adaptogens that doesn't really have a good correlate with our current treatments in psychiatry. I guess the closest it comes would be an SSRI or medication that helps you with sort of stress resilience. And adaptogens are substances that help you withstand the burden of stress, or help you perform even under stress, and can even enhance cognitive performance. So two very well-known examples are rhodiola and ashwagandha. Just know there's many more, but I bring those two up because, again, one is a little stimulating, one is a little sedating, or can help with sleep. So depending, again, what type of symptoms a person is experiencing from the mental health standpoint, as well as from the physical standpoint, and looking at these other properties that these herbs may have, you can choose the right kind for your unique situation. Here's an example of this whole person integrative approach can play out when working with a patient. Here's an example of a 45-year-old female with anxiety, depression, and adult ADHD, as well as Hashimoto's disease, which is an autoimmune condition of the thyroid that can predispose someone to having too little of thyroid. So this person is treated with the typical treatments for anxiety, depression, and ADHD using SSRI and antidepressants and stimulants. And when coming to us for integrative consult, things that we would look at typically would be, let's take a look at the lifestyle. Are there opportunities there to optimize mental health? Often the daily routine, especially if you have ADHD, can be dysregular and not enough sleep. So working on that piece, like sleep being the, this is a bit of a cliche, but really being kind of the building block or the necessary step for mental health. Looking at diet and hydration and movement, those things can really increase both physical as well as cognitive energy. For this particular person, what was very important too is to look at history of trauma. And not uncommonly, history of trauma may actually be linked to autoimmune conditions. And working through trauma through psychotherapies that emphasize sort of tuning into the body. So psychotherapies like somatic experiencing, EMDR, or mindfulness-based therapies. Looking at nutritional deficiencies and things, checking into vitamin D, zinc and copper balance, using magnesium supplement for someone who has sleep and anxiety issues can be helpful. Because of the history of autoimmune thyroid condition, we also pursued a gluten-free diet, and in those conditions, gluten often increases the autoimmune response, and so that can be quite helpful. Because this person was under a lot of stress, it was very important to try to optimize the stress resilience by using an adaptogen, talking about mindfulness practice and thinking about, what kind of things can you do? Sometimes we tell somebody, do mindfulness practice, and that can feel overwhelming. I have no time for meditation. I'm just too stressed. So talking through the steps of how can you bring it more into your life without feeling overwhelmed by the stress and stress reduction interventions. For this person, what was very important was to also work with our acupuncturist and naturopathic physician, Crystal Montgomery, because those tools can be quite helpful on a number of levels, working with anxiety, depression, stress, looking at the autoimmune condition, and understanding other contributors to that. So quickly, I want to just introduce our team to you. Debbie Cohen is mindfulness and yoga trainer with background in positive psychology. Another faculty that's part of our team who's not here today is Piper Meyer-Cullis. She does research with positive psychology and psychosis. Kristen Montgomery, naturopathic physician, acupuncturist, and Theresa Knott, integrative health and wellness coach. So quickly, I want to say what our team has been doing. We've been involved in offering some courses and webinars to the community, as well to Health Fairview employees. You're welcome to join some of our webinars. They're brief sort of mindfulness webinars, and we're looking to collaborate with the Center for Spirituality and Healing as well. my work is very much with resident education. So bringing this approach, bringing this framing into the residents and creating clinical services for patients. Here we have 2 locations where Crystalline Montgomery is offering acupuncture combined with Chinese medicine and naturopathic medicine, insights into mental health. We just started offering integrative psychiatry consults through working with our residents, and have Debbie and Teresa available for individual training of either mind body skills or health and wellness coaching. So with that, I will stop, and I just have a couple slides with different resources around mindfulness as well as integrative mental health, but we can turn over to questions.
So Lydia, I think I'll have you pull your slides down. So then the pictures of the panelists will be a little bit bigger. So thank you for doing that. Well, we have had 40 questions come in, so we'll only be able to, touch a few of them, but I want to start the question, Crystalline, for you. And it's about sort of irritable bowel syndrome. And the question is, do women with gut and IBS issues report a foggy brain problem? Is this possibly due to, hormone changes? I've seen this reported from some women around the ages of 50 and 60. Mental health wise, I feel like this isn't addressed very much.
That's a great question. In my practice, what I've seen clinically is that you will see people in that age range where there's a constellation of symptoms going on. And that could be due to fluctuating hormone levels, which often take place around perimenopause, menopause, and even postmenopause. But I often find it's not just hormones. It's often layered with, there's HPA axis dysregulation or chronic stress. So a lot of people think about their adrenal health. And so if there's been chronic stress over a long period of time, that will also impact that brain fog as well as gut health. So when you talk about irritable bowel, there's all these factors that can influence the severity of irritable bowel. And then you end up with this cycle where the microbiome gets disrupted, and then that can exacerbate things like brain fog with, if you have overgrowth of bacteria or overgrowth of fungal microbes, that those will trigger the release of certain substances that can cause brain fog. So it's often multidimensional in terms of the treatment, but you certainly have to pay attention to all of those hormones, microbes in the gut, as well as adrenals. And so they're all important.
Thanks for that, Crystalline. Debbie, I'll pitch this one to you. Somebody writes in, I can't say enough about how impactful a mindfulness practice and meditation has been in my life. Any advice on how to enhance this practice or make sure that it's maintained?
That's a great desire to keep it maintained. A couple of things that people have found helpful are finding a certain time of day where you can commit to that time. And then the more you do it at that time, the more it will develop like its own kind of mental groove. And the other things you might do is kind of reinforce for yourself how well you feel, whether through journaling or through recording and listening. Record about and keep in mind how you feel when you do this practice, when you keep this commitment to yourself. And so keeping in mind why you want to do it and how you feel when you don't follow through on it is another good thing. Other things that are helpful are using timer, like alarms on your phone that go off at a certain time where you want to be practicing. That can be helpful. And finally, having a buddy, having someone you're accountable to sometimes other than yourself, can be a support.
Oh, those are great tips, Debbie. Lydia, I'm going to pitch this one to you. Somebody writes in, I'm a 55-year-old woman who's been diagnosed with ADD, ADHD, and numeric dyslexia. I'm currently working with a disability resource center. Do you have any recommendations?
Oh, well, what I would say is that, ADHD is a great example of a condition where the whole person is affected, because ADHD can in fact make it more difficult to follow healthy health routine, and it can make it more difficult to also deal with stress. So those dimensions are really important to look at and understand for yourself. What are the areas of vulnerability for me, and what are the things I'm prepared to or ready to tackle. Sometimes, especially when I work with ADHD, we talk about these recommendations and they can be overwhelming very quickly. Like, oh, I have to do supplements, I have to do diet, I have to change a lot of my habits. So I would say, and this also applies to previous question with mindfulness, find something that within this idea of healthy lifestyle, those fundamental wellness practices that you think would have the most impact for you and are doable for you, and start there. Having somebody along the way on this journey is critical. So working with a coach, or maybe again finding someone in your social circle that would support you in that, you can check in with, can really be like a game changer too.
Great. Thank you for that, Lydia. So Teresa, I'm going to pitch this next one to you. Somebody writes in, how do I work on mental health in the context of chronic physical health issues, like not being well enough to get out of bed and into nature?
What a great question. Thanks for that, Mary Jo. And I would answer that I think we have to manage our expectations sometimes. We can work on our health without doing some of the things we think normally. Research has shown things like looking outside into nature can be just as helpful as actually being out in nature. So partially, I think a part of it's managing your expectations and taking the small actions that you can take, whatever those are. Mindfulness is a great way to work with, and especially I think in my history of being a nurse, I'm going to bring that in because I'm a holistic nurse as well as a health coach. People often have health conditions that go along with depression and anxiety, and it can really limit. So I think it's so good to just start small, do something consistently, and do what you can.
Thank you for that. Crystal, and there are a few questions around acupuncture and use of acupuncture with mental health. So can you talk about, with what kinds of conditions is, acupuncture worth considering?
Yeah, acupuncture works really well for many different conditions. So I'd say there's quite a range. And, I think what I look more at is less what condition they have and more, are they a good candidate? And what a good candidate would be is, are they able to come in for a treatment? Would they feel comfortable either sitting in a reclined position, or even sitting in a chair, or lying on a table? Usually I'm doing more to check in with their comfort level and understanding, their background in terms of trauma, their feelings of safety in the room. And then beyond that, acupuncture is really looking at the body holistically. So we're going to look at, we're going to take cues and signals from the body that go beyond the diagnosis to understand the best treatment for that person to help treat the root cause, which briefly, we're trying to balance the movement of energy in the body. And we're trying to, as we balance that helps restore balance to both mind and body. So.
Thank you for that. So Debbie, how do you encourage someone to start to practice mindfulness who finds the very idea of it stressful?
That's a great question. And I like how Lydia mentioned earlier, starting with something small, something that feels doable. And then just knowing that, thinking about how if you just sit down for a minute, if you're drinking a cup of tea, you're not doing anything different from what you would ordinarily do. You can be aware of certain aspects of that experience. I'm aware of the heat of the cup in my hand. So you're already practicing awareness. And then, so you can play with this yourself. It's not like people practice mindfulness, people don't practice mindfulness. It's a tool for getting perspective and cultivating the ability to be with ourselves. We often do this naturally through age. This is a way of heightening that and making it really conscious and breaking it down into steps. But I think to say I can't do that or I don't do that is really not true. Like, we all do this a little bit. So even like there's a 1 minute stop practice one could take to start to play with, what am I aware of now? And how can I start to work from there? But starting from where we are, kind of like what we talked about with the person who's in the bed. And
if
So
I could
Debbie,
add to that, oh, sorry.
go ahead.
This is such a great question, and comes up so much in my work with ADHD, because mindfulness meditation often evokes this image of having to sit still, having your mind being focused and not, and quiet. And when you have ADHD, it's hard to sit still. It's hard to have your mind quiet down. So there's a lot of sort of fear about meditation, or if you've tried meditation, you really felt like it wasn't helpful. So I often recommend to really think of mindfulness as something that we, as Debbie mentioned, we have capacity for already naturally. It's a sort of dropping into awareness and working with curiosity. So the 2 steps of mindfulness have to do with this awareness, attention, one with attitude. And you could actually even break that down. If doing brief shifts into mindfulness in your daily life feel difficult, then just do experiments. What if I were just more compassionate to myself from time to time? What would happen? So just work on the attitude piece. Or what if I just brought more curiosity to the present moment from time to time? What do I start noticing? And I think the body, or checking in inside, is where you can also have a lot of benefit from. Just checking in on your stress level, taking 1 deep breath when you notice yourself stressed, and then keep going.
Thank you for that, Debbie and Lydia. So Lydia, there's a couple questions I'm going to pitch to you that are and they're not necessarily quick answers at all, but important. One person writes in that they have been diagnosed with bipolar syndrome and want to know, are there integrative approaches that they should be considering, or is medication the only thing that will help?
That's a great question. I think, medications are often a very important piece of treating bipolar disorder, and can really make a difference in someone's life. That doesn't mean that you can't really work on your mental health and the sort of mind-body balance. We do know that looking at structure of your day and kind of lifestyle practices, particularly regular sleep and exposure to light, can have a tremendous impact on mood and bipolar illness. We know that stress is often a trigger for, let's say, manic episode or depressive episode. So working on both resilience skills through mindfulness or self-compassion, or this bottom-up approach, doing acupuncture or working on your diet and healthy gut, definitely can make a difference. There are some supplements that are used as well. For example, people do use fish oil as a potential help. The evidence is weak at this point, but you can really think of approach to this as, what do we know about supporting the brain, right? And what do we know about supporting a kind of homeostatic or balanced mind-body state in terms of effects on stress, inflammation, things like that. Someone with bipolar can definitely address those things, and oftentimes they can find their mood symptoms improving and their quality of life improving. And the hope is, for some people, they can also start peeling back some of the medications and thinking about, what is the medication that is key for me, and then what are some other things that can supplement it.
Great. Well, Lydia, I'm going to pitch the final question to Teresa. And Teresa, somebody is curious about, health coaching, and if they're struggling with, a mental health condition like anxiety or stress or depression, what can a health coach offer?
Thanks, Mary Jo. Yeah, so I think health coaching is great when you're struggling with mental health if you have a great treatment team around you, because as everyone has mentioned in different ways in their answer, it's one thing to know what will help you, and it's another thing to implement. And so health coaches are great at helping you break it down, find out what's going to motivate you, help you take small, sustainable action, and stick with your change. So I think there are many things I could say, but that's what I would say in a quick summary.
Well, thank you so much for that, Teresa. There were 62 questions that were entered, and so I apologize that we could not get to all the questions today. A few closing comments. I want to first of all thank so much Dr. Lydia Zylowska and the panelists for joining. It's really exciting having this integrative team at the University of Minnesota. So I think that from this webinar, you've gleaned that a whole person approach to mental health and well-being is so important. And I want you to know that in addition to clinical services, that approach also permeates many of the academic and community courses that the center offers. So be sure to check that out. The center has a free website called Taking Charge of Your Health and Well-Being. And we get about 2.5 million unique visitors every month on that website. Offers many tips focusing on mental health and well-being. So do check that out as a resource. And as you visit that site, we encourage you to also explore our well-being model and learn about how all the factors of well-being can have an impact, which includes not only health, but purpose, relationships, community, the environment, as well as safety and security. So thank you all so much for joining us today, and I wish you a good day. Bye-bye.
Thank you.